Hello, my name is Paweł Kubik, and I have a pleasure to be the medical ambassador for the Neauvia brand. Welcome to Neauvia Pills of Science meeting devoted to the Russian lips technique. In the next 15 minutes, I will try to introduce you to this treatment technique in the Neauvia style edition. Each technique that we prepare for you is specially adapted for administration of Neauvia fillers, and therefore those techniques are unique and often differ from what you have already encountered. The goal of developing Neauvia fillers is not simply to create a better product. Our goal is to provide specialists like you with a completely different product with the best properties suited to the injection site, both in the terms of anatomy and physiology, allowing you to obtain the natural results in the safest way. You will find hundreds of lips augmentation procedures. In my opinion, choosing the best to use is that you feel good in this procedure and you do a proper examination of patient's needs. There is no such thing as one perfect proportion of the face. We differ from each other, but there are some general rules that we can follow, knowing that mostly we like the young and healthy appearance. And knowing that, according to the lips, we can see that they should be clearly marked in the face while not dominating other areas. So always look at the surrounding areas such as chin, cheeks, and observe if they don't need augmentation to create a space for more defined lips. The second thing is the frontal proportion of the lips. In most cases, it is desirable that the lower lip discretely dominates in the size over the upper lip. Looking from the side, notice that usually lower lip is naturally discretely protruding from the upper lip. If this proportion is very unbalanced, please check if the patient does not have severe dental malocclusion. In such situation, orthodontic or prosthetic treatment should be considered. So you can see, usually we are speaking about 2 times greater distance between the chin and the lower lip than between the nose and the upper lip, and having a little greater volume of the lower lip. Please always speak to your patients and ensure that the expectation can meet the reality that you can deliver. Sometimes, if our patient expects a bigger result, I recommend to split the whole treatment into 3 or 4 sessions, usually using no more than 1 milliliter per session. Lips area is highly vascularized. The arteries in this area depart from the facial artery. We should always pay close attention to superior labial artery that goes along the muscular border of the upper lip and to inferior labial artery that in a great part goes below the lip, but in the central part it usually runs deep in the lower lip below the muscle. In cross section, you can see that most of the arterial blood vessels you can meet at the lower border of the upper lip and top border of the lower lip. Knowing this, it is not suggested to inject directly from vermilion close to inner part of the lips. Studies shown that the depth of the arteries that interest us is between 3 to 7 millimeters. So our safe technique should take into account placing the material no deeper than 3 millimeters. Neauvia fillers are currently the only injectable products based on hyaluronic acid that have been tested in vivo, which allow to demonstrate the beneficial effect of the PEG cross-linking for both mechanical and biointegration properties, but also immunomodulatory effect, reducing the risk of inflammatory consequences of implementation. Our first choice of the product for lips augmentation is Neauvia Intense Lips. This dedicated product will provide natural results with perfect volumization property because of the proper balance of medium hardness and cohesivity. Medium extrusion force needed to implement Neauvia Intense Lips help us to keep small volumes of the product in every site of injection, which is crucial in the lips technique. If our patient is worried about potentially too big volume result or just want to refresh the lips, I will recommend Neauvia Intense Rheology, which is softer product than Neauvia Intense Lips. Because, in my opinion, it is unacceptable for the patient to feel any pain during the procedure, and especially that we are talking about the most pain sensitive area, it is necessary to anesthetize the area of injections. In my opinion, using cream is too weak and time consuming. I prefer to do anesthesia by injections. You can do simple, fast, and effective infiltration anesthesia directly to the lips. In such case, I recommend using around half ml of 2% lidocaine or a 4-point nerve block. The Russian lips is in fact a group of different techniques that derive from Parisian lips but are significantly improved. Today, I will show you one of the most common way to do the Russian lips. This technique itself focuses on rolling up the lip, providing a significant effect using small volumes while maintaining the natural and desired shape of the lips. At first, please focus on the cupid arch part. From the top of the cupid arch, I introduce my needle and using retrograde technique, I implement 3 columns of the material without removing the needle. Usually, I use zero point 0.1 ml for each cupid arch. Then I go laterally, creating from 5 to 8 columns, it depends on the lips width, still using retrograde technique and giving a small amount around 0.02 ml for each column. And here, 2 very important things. First, use one finger of your non-dominant hand to keep the lip rolled up during all procedure. And second, introduce your needle on the lip border, but through the skin, not through the vermilion. Once finished, with the upper lip, I will go to the lower lip. Remember about rolling up the lip. And I start from the external part of the same columns, usually 5 to 8 columns, using very small amounts. The final point is creating tubercles of the lower lip. They should correspond with the cupid arches of the upper lip, and they shall not merge in the middle, so keep some distance between them. You can even put a stick in the middle of the lower lip while injecting. I create them by implementing 0.1 ml bolus. In 99% of cases, I use 1 ml at one visit. Just after the procedure, I check that the material cannot be felt by the patient. If it is, I press gently, but I do not massage it. And now you can see all this procedure at the video that we prepared for you. As you can see, we have a young lady as our patient. This is not her first treatment. I treated her about 1 year ago. She was anesthetized. And now we start the procedure. You can see rolling up the lip with one finger of my non-dominant hand, and we create a tripod under the cupid's arch. I will use around 0.1 ml for this. I do not remove my needle. And now to the columns. See, always rolling up the lip. We are very, very superficial. no more than 3 millimeters, but usually even more superficial. I prefer to create up to 8 columns, not to harm the patient. Sometimes you can use even more. This is more classic way in this technique. But regarding the rheology properties of Neauvia filler, I prefer around 5 to 8 columns. The columns are beginning to shrink. They are shorter while going laterally and longer in the central part of the lips. Now the second side. First the cupid arch around 0.1 ml. And now we can go to the lower lip. In the lower lip, I usually start from the external part, creating the columns. So the same as you had in the upper lip, always rolling up the lip. You can see that we are quite superficial. And here, corresponding to the cupid's arch, we are creating a bolus to recreate the tubercle of the lower lip. It is not in the middle, it is just below the cupid's arch. And now the other side, the same technique. As you can see, I am rolling up the lip with my non-dominant hand. This is very, very important in this technique. And it's finished. At the end of the procedure, I always gently check if the patient cannot feel the material. For me, in the lips, it's not acceptable to feel the material. If you can feel the material, just gently press it. Do not make a hard, strong massage. It's not necessary. By gently pressing, you will just go with the material that is integrated with the lips, and the patient will not feel it, having a great natural result. Our tips and tricks. Because we are safety fanatics, this will be a few words about safety injecting. As I told you before, you should expect arterials at 3 millimeters and deeper. So it is considered safety to not inject deeper than 3 millimeters. And to achieve a brilliant natural result, please roll out the lip with your finger of the non-dominant hand through all the time of the procedure and keep the bevel of your needle direct downwards to avoid revealing the structure of the material shallow under the vermilion. And observe all the time during the procedure and directly after. Usually, if you accidentally create some nodules, you can just massage it. This is unwanted, but this is not a problem. The problem is when you will see a bleaching of the vermilion and or a large bruising. This is a signal about damaging the arteria, which can be connected with internal or external arterial occlusion. This can lead to most unwanted complication, the necrosis. The good news is that with a proper technique, it is a very, very rare situation. And even if it happens, you can turn the tide by quickly implementing the correct procedure. Act directly when you can see a problem. Inject at least 35 to 50 units of hyaluron days and massage it to spread into the affected zone. Observe if the blood returns. If not, give a higher dose. After that, it is good to use a nitroglycerin paste to open the vessel. Administer aspirin and use warm compresses. Contact your patient frequently. See your patient next day or any time if needed. Of course, always remember about aseptics. Examination before and after the treatment may reveal unwanted lumps. Use as small gauge needle as you can regarding to extrusion force that you will inject your material slowly. You can use antibiotic or steroid ointment after the procedure to reduce the risk of bacterial contamination and edema. Work small with small volumes. Aspirate. If bigger volume is needed, do it in several sessions. Avoid doing the procedure if patient had herpes in last 2 weeks. Keep calm, use Neauvia because it reduces inflammatory risk. When speaking about patient selection for lips augmentation, the most important issue is to discuss with the patient their expectations and our capabilities. Additionally, you should take into account eventual disproportion between upper and lower lips and left and right side. Skin condition in the perioral area that sometimes may need to be improved, and especially the relationship in proportion between existing lips and surroundings, such as chin, cheeks, and nose lips distance. Having all this considered, you will receive a brilliant result in a very safe and effective way. Thank you and hope to see you soon.